next person says, I suspect I have gut issue along with hormonal imbalance. What's the best way to get started figuring out the root cause of both? So great question and common issue. Whenever I see a female with female hormonal issues, they almost always have gut issues along with it. So if you know you have gut issues, like you're not having a bowel movement 2 to 3 times a day, either it's too excessive or it's not often enough, that's a sign. If you get bloated, if you have any stomach pains, if you have any issues with the stomach at all or the gut at all, then that's like it's easy to know that that's probably at least part of the equation. And the reason that the gut affects hormonal release is that it's just the proximity of the two systems. So you have the gut basically surrounds the female reproductive system. And if you have inflammation, you have issues there, you have toxicities there, it seems like it just readily affects the system next to it. So that's one problem. 2 is through something called, a big long word, beta-glucuronidase. And to understand how that works, we need to go back to how your body gets rid of different hormones, including estrogens. So we talked about, in another question, we talked about histamine and how we want to look at how histamine comes in and how it's produced and then how your body gets rid of it. And you have to address both ends of the equation. So with female hormonal issues, a lot of people have problems with estrogen dominance. So if you type in Google estrogen dominance and you see the symptoms of that, chances are if you're having female hormonal issues, it's because of estrogen dominance. So with estrogen dominance, we need to look at, okay, how's the body producing it? And then how are they getting rid of it? How are they processing it? And in this case, it's how are they getting rid of it? How are they processing it? So the main way to get rid of it, process it, is through filtering it in the liver through something called glucuronidation. Basically packages up the estrogens and puts them in a box that says, okay, these are packaged to exit the body. They store it in the gallbladder as bile, or it's part of the bile, and then it goes into the digestive system, into the gut when you eat your foods. And part of the bile's job is to digest fats, but it's also there to help carry toxins and other metabolites of things like estrogen out of the body with a bowel movement. In a perfect world, when you eat your foods, you're eating plenty of fiber with your foods. The bile, including the packaged estrogens, get trapped by this fiber, get soaked up. It goes through your digestive system and then out the other end, and you excrete it. You get rid of it from the body. It's no longer part of your body. In an imperfect world, what commonly happens is a couple things. One is you don't need enough fiber. So it goes through, it doesn't get soaked up by the fiber. And then instead, before it makes it to the other end, it gets reabsorbed through the intestinal walls. And that will happen regardless. But what really accelerates that or makes that problem much worse is that you have this beta-glucuronidase, which is released by abnormal gut bugs, that they're ripping the boxes open. So now it's not packaged to leave anymore. Now the estrogen's back into the gut, just hanging out by itself. It's readily absorbed through the gut wall, just like we absorb all our nutrients. And it gets back into the blood and says, hey, we're back, we're ready to go. And if your body's already producing estrogen, trying to release a certain amount because it wants to be at certain levels, and now you're recycling some, so now you have extra, well, that does a few things. One is it raises your estrogen levels. You have these estrogen metabolites. And by the way, there's several different types of estrogen metabolites. Some are more harmful than others. So if you have some of the more harmful ones that reabsorb, that's a problem. 2, your liver has to re-filter those things again and package them up again. So it's extra work on the liver as well. The third thing that's bad is you're taking all these metabolites through the colon, is where most of these are absorbed. And it's not just estrogen, it's could be toxins, could be other things as well. And you're exposing those colon cells to all these toxins, so you can lead to a higher risk of colon cancer. And in fact, when we look at the research, if you have a high amount of beta-glucuronidase, basically that's the unpackers, that you have much higher risk of colon cancer. So just a lot of really good reasons to look at the gut when you have female hormonal issues. So if you suspect a gut issue along with hormonal imbalance, yes, that's absolutely can be the case. There's a pretty clear-cut connection there. So I would definitely say you'll definitely want to have that checked out.